class, the last thing I want to talk about is tumor lysis syndrome. The video prior to this only allowed me to audio record for an hour, so I just want to make sure that you got this information about tumor lysis syndrome. So you'll see a second link for this particular audio video. So it'll just be a short little snippet about tumor lysis syndrome. But it's a very important a concept in regards to when we treat these cancerous cells, because we're killing off such a large number of these tumor cells. They're destroyed so rapidly that the kidneys are not able to excrete the byproducts from the destruction of these cells. So because of the aggressive killing of these cancerous cells, their intracellular contents are being released out into the bloodstream faster than the body can eliminate them, okay? And you can really develop some very serious situations, okay? Because think about what's inside these cells. And let me go to the next slide and show you that here's the intact cancer cells. Treatment is given to try to destroy these, so they're being destroyed. So you're having the tumor kind of lysed or cut, where now the internal components are being released out into the vasculature, or out into the bloodstream. And within that cell is potassium, uric acid. So this really puts our patients at extreme risk for developing, obviously, hyperkalemia, causing you to assess a tall T wave on the EKG rhythms, sometimes flat P waves, bradycardia, GI hypermotility. And so along with that uric acid, these patients can definitely develop gout-like symptoms, because the purines are released and then converted in the liver to uric acid. And think about it too. This is a lot for the kidneys to take on. So what develops is that sludge that we talked about earlier, where you have the lysis of the cells. So because of the sludge developing in the tubules in the kidney, it's not uncommon for these patients to develop acute renal failure. Okay, so to help alleviate some of these immense cellular components being released in the extracellular fluid, we want to definitely hydrate these patients, sometimes up to 3,000 milliliters a day. And you know, you've got to look at the patient's health history and see if this would be a contraindication. But if we hydrate and really flush out all those components, we'll prevent a lot of that sludging, and hopefully the kidneys can take over and remove some of these abnormal levels of these cellular components, okay? Many times too, these patients, because of the amount of these cellular components that are being released out into the vasculature, these patients can really develop a lot of nausea, vomiting. So obviously we're going to treat that. Some of them are experiencing a lot of pain because of the type of treatments and therapies that we're using to try to eradicate these cancerous cells. So we definitely want to treat our patients for the pain that they're experiencing. Sometimes we use some complementary therapies, botanical agents, nutritional supplements, energy healing, spiritual approaches to hopefully helping with their pain management. We might see tumor lysis syndrome with some of the cancers that we have definitely talked about, leukemia, lymphoma. even some of the small cell lung cancers, and also multiple myeloma. So obviously we're going to assess for symptoms of hyperkalemia. When we suspect this can occur, we should probably, or most definitely, have them on some kind of EKG machine, some kind of telemetry, or even in the critical care units to prevent some serious arrhythmia from occurring because of the hyperkalemia that can definitely occur with tumor lysis syndrome. So hopefully that makes sense, and on both of these videos. So if you have any questions about anything, feel free to send me a text or an email this week while you're studying and preparing for your hematology test. And I wish you all a very good spring break, and let me know if you have any further questions.